So, why Health Innovation North? Simply because, as those of us who live and work here already know, our region is an absolute powerhouse of industry, innovation and healthcare. Our northern economy in England is worth more than £340 billion, which is greater than Austria and Norway combined. We also now have more devolved power in the north than elsewhere in the country, with 9 combined authority mayors out of a current total of 14 across England. And as health innovation networks who deliver local change for national impact, devolution has become a substantial opportunity for us to influence and champion the local growth plans of our respective places, ensuring that health and life sciences are at the core of our mayoral priorities. And as an example, here in West Yorkshire, we've just launched our new Propel Health Tech programme. That's doubled in size and ambition, £4.5 million worth of funding from the West Yorkshire Mayor's Investment Zone. That means that over the next 4 years, we're going to support up to 240 businesses, helping them to scale up in the NHS, contribute to our regional economic growth, bring jobs, and develop life-changing innovations for patients. And as always, there's so much to celebrate. So if we stay just here in Yorkshire for a minute, we should also note the fact that the MHRA has chosen Leeds as its location for its new digital hub. That's an investment that will help to attract top talent, boost regional partnerships, accelerate the pipeline of innovation from lab to patient. And also Leeds has been named as one of the 3 new thematic campuses leading government's health mission that places local communities and frontline workers at the heart of policy development. Across the Pennines in Greater Manchester, there are strategic alliances between healthcare and industry that are addressing major population health challenges, with a particular focus on reaching into underserved communities to address inequalities. And their Health Innovation Accelerator programme is a beacon of that approach, leveraging around £30 million worth of public and private funding over 3 years. And actually, just this morning, medical products and technology firm Convatec has announced a £500 million investment for a new flagship research and development site in Manchester. Staying over the Pennines in the northwest coast, there are really ambitious plans to establish a national centre for health and care robotics, using the principles of the Living Lab, which will harness expertise and technologies from a range of sectors. And further north, over the last 12 months, Health Innovation North East and North Cumbria have secured £2.5 million in partnership deals with industry focused on population health priorities, including cardiovascular disease prevention and chronic kidney disease. They assess their new ideas using their innovation pathway, which is now integrated into their ICB governance processes, hello Sam, to accelerate decision-making relating to new opportunities. As a network, we've just published our latest health national impact report, which details how over the last year as a national network, we have delivered national programmes that benefited well over 1 million patients. We've created or safeguarded over 900 jobs in the UK. We've created wealth by leveraging almost £500 million worth of investment through our support to our innovators, which when you actually track back to 2018, that's over £3 billion worth of investment leverage through our support as health innovation networks. But there is a lot more on the table to go after, and we are really ambitious to do more. Our recently published Health Innovation Network report defining the size of the Health Innovation Prize showed that innovations in healthcare could boost the UK's growth by bringing in around £246 billion every year to our GDP. It calculated that the economic value of reducing ill health through innovation is an equivalent of 9.6% of the entire British economy. And that's exactly what Health Innovation Networks were set up to deliver. So today is all about collaborating. We do need to think collectively and constructively challenge each other to do things differently in the way that we deliver our healthcare. The 10-year plan and the life science sector plan give us clear signals of the government's priorities for health and growth. Now, we are here to do more at scale to achieve those ambitions, but we can't do it without your help and partnership.